So what we've done this year at the Patient Safety Congress is to have the National Outreach Forum, the UK National Outreach Forum, co-locating with the main meeting. And that's really just continuing the theme from last year, that the understanding that frontline clinicians, this time British frontline clinicians, need to work with and understand the bigger patient safety perspective. And indeed that the bigger group of people interested in patient safety need to understand the frontline perspective. And in many ways the outreach teams and the rapid response teams are the canaries in the mine. They see up front the sorts of issues and the human factors and the technological problems that are associated with failures to rescue deteriorating patients. And we can learn from the bigger system and the bigger system can learn from us. I think it's fantastic that this hopefully will be a continuing theme.
Okay, so National Outreach Forum decided to partner with Patient Safety Congress last year because it gave us a platform to work together and actually, again, not only share our knowledge but also share our audiences so that there will be cross-fertilisation across both National Outreach Forum and the Patient Safety Congress, and also to think about that patient deterioration affects everybody, and actually there are many things that we can work on together to improve patient care.
So why is it important for the National Outreach Forum to align with patient safety and the two to work together? I think it's vital. Patient safety is foremost in all our minds, and our logo at the National Outreach Forum is right time, right place, right people. Early detection, early prevention. And my message is I'm coming from the independent sector, and I would like to think that across the UK that this is a standardised approach to patient safety.
Yeah, so there's some new technologies in terms of supporting critical care that are in the pipeline, and some places are already using these, such as things like wearable portable monitoring that are really starting to transform outreach care, particularly in terms of where we need to be able to monitor patients and where patients need to be kept safe. And wearable technology is certainly transforming delivery of care in that sense.
So in the world of rapid response systems, particularly in the UK, there have been some massive advances over the last several years that I think are going to continue. So we're the first country in the world to have developed a national early warning score that can be used in primary care, in the ambulance service, and in the hospital, a common language that we can understand.
Yes, there's a lot of things that excites me about the world of outreach at the moment and moving forward. Again, I'm in the independent sector. I represent the independent sector UK. So I'm actually here to drive standards throughout the independent sector that we would be the same as the National Health Service. Currently we're looking at the standards of outreach practitioners, competencies, and working towards competency so that all outreach practitioners would have the same competencies.
The Patient Safety Congress last year was great because lots of people came together, we were sharing good practice, there was a huge buzz around, we had some phenomenal speakers, and it was a really great, vibrant atmosphere to share practice and share learning.
I was at last year's Patient Safety Congress and Rapid Response Conference, and I thought it was a fantastic event. It allowed us to network internationally with colleagues from all over the world. Our theme is so much about the deteriorating patient in the hospital, which is obviously got a very important, massive significance in the patient safety.
So I attended the Patient Safety Congress last year. It was a wonderful event, a two-day event in Manchester. So there was a broad networking opportunity there available for myself, not just for myself, for all my colleagues from the National Outreach Forum. There was such a great spectrum of expertise there that we could draw on each other's expertise, all for the benefit of the patient safety.